What is schizophrenia? Schizophrenia is a dangerous mental illness in which patients have unusual views of reality. It affects about 1 in every 200 individuals in the United States at some point in their lives. It can hit anyone. Schizophrenia patients frequently struggle in society, in education, in relationships, and at work. They may appear fearful and withdrawn as if they have lost contact with reality. Its symptoms may include experiencing hallucinations, disorganized thinking, lack of motivation, and change in sleeping patterns among others. Schizophrenia is majorly caused by genetic factors, family relationships, stress, and drug abuse. The focus of schizophrenia treatment is centered on symptom management. Schizophrenia disorder. Schizophrenia is a long-term, complicated medical condition. Although the actual prevalence of schizophrenia is difficult to determine, estimates range from 0.25% to 0.64% of all individuals in the United States. Schizophrenia is uncommon before adolescence. It mainly strikes teenagers and adults. Gradual changes in thinking, emotions and social functioning normally begin in mid-adolescence, before the first episode of psychosis. It's possible that you'll need to see the psychiatrist several times before they diagnose you with this condition. This is because they need to know how frequently you get symptoms. Majority of people with schizophrenia are unaware that they have it until a doctor or counselor informs them. They will be unaware of the fact that something is really wrong. If they do notice symptoms, such as being unable to think clearly, they may link them with stress or exhaustion. Schizophrenia symptoms. People with schizophrenia usually have the following symptoms. 1. Delusions. These are incorrect views that are not real even if they appear to be genuine to you. Your beliefs are likely to be challenged by others, but holding a religious or spiritual belief that others do not share is not the same as having a delusion. For instance, you believe that you are being harassed or hurt, another person is in love with you, you possess superhuman abilities, you feel that you're very famous, or a catastrophic disaster is coming your way. Most patients with schizophrenia have delusions. 2. Hallucinations. Hallucinations are only relevant to the individual experiencing them. The voices are often from someone you know, and they are frequently negative, nasty, or abusive. Visual hallucinations are also common, and they tend to be worse when you're alone. The majority of them involve seeing or hearing things that do not exist. Hearing voices is the most prevalent type. However, hallucinations can impact any sense. A person might, for example, see, feel, taste, or smell things that aren't really there. 3. Disorganized thinking. When you have disorganized thinking, you may speak quickly or slowly. Others may not understand what you're saying. You may change topics or your words become mixed, making it difficult for others to grasp what you're saying. Other symptoms may include loss of motivation, neglecting personal hygiene, reduced feelings of pleasure in daily activities, withdrawing from family and friends, having trouble sleeping, difficulty in concentrating, less or reduced speaking. Causes of schizophrenia. Genetic inheritance. Schizophrenia runs in families, although no single gene is believed to be the cause. It's more likely that different biological combinations put people at the risk of getting the disease. Only 1% of people develop schizophrenia over their lifetime in the general population. Although if one parent has schizophrenia, the children have a 10% chance of acquiring it, and a 90% chance of not developing it. Changes in brain chemicals. Neurotransmitters, a group of highly interconnected molecules in the brain, are responsible for exchanging information between brain cells. Low amounts of these substances, or chemical imbalances, are thought to have a role in the development of schizophrenia and other mental illnesses. Environmental factor. It has been proven that early exposure to viruses or malnutrition, particularly in the first and second trimesters, increases the chance of schizophrenia. Studies have discovered a link between autoimmune illnesses and the onset of psychosis. Living in poverty, being in a stressful environment and being exposed to viruses or nutritional deficiencies before birth are all possible contributors. Childhood hardships. Childhood trauma is also suggested to play a role in the development of schizophrenia. Some patients with schizophrenia have hallucinations that are linked to adverse childhood experiences or neglect. People are also more prone to develop schizophrenia if one or both parents died or separated permanently while they were children. Stress. Stressful life events are the main psychological triggers of schizophrenia, such as sorrow, losing your job, ending a relationship, physical or emotional abuse. These types of events can cause or trigger schizophrenia to develop in someone who is already susceptible to it. Use of alcohol and other drugs. Harmful alcohol and other drug use, especially cannabis, can lead to psychosis in those who are prone to schizophrenia. Taking mind-altering drugs during adolescence and young adulthood has been linked to an increased risk of schizophrenia, based on established research. Treatment for schizophrenia. Schizophrenia requires lifetime therapy even when symptoms have faded. Medication and psychosocial therapy can be used to assist in controlling the illness. Hospitalization may be required in some circumstances. Each person's experience will be unique. A doctor will customize the treatment to meet the individual needs. Treatment is usually guided by a psychiatrist who has experience treating schizophrenia. The following are some examples of schizophrenia treatment. Cognitive behavioral therapy, CBT. CBT seeks to assist you in identifying the thinking patterns that are leading you to experience undesired feelings and behaviors, as well as learning to replace these thoughts with more realistic and beneficial ones. Family therapy. Family therapy is a method of assisting you and your family in dealing with your illness. It entails a series of interactions over a 6-month period. Family members can provide care and support to one of their own that is affected by schizophrenia. While most family members are willing to assist, caring for someone with schizophrenia may be stressful for any household. Rehabilitation. Schizophrenia commonly manifests during the years when we are establishing our careers. Therefore, problem-solving assistance, money management education, and job counseling can be included in the rehabilitation process. Antipsychotic drugs. Antipsychotic medicines are the most widely administered drugs. They are the cornerstone of schizophrenia treatment. They're considered to work by altering the dopamine neurotransmitter in the brain. The goal of antipsychotic drug treatment is to successfully manage signs and symptoms while using the least amount of medicine possible. Schizophrenia can hit anyone. It affects about 1 in every 200 individuals in the United States at some point in their lives. Its symptoms include experiencing hallucinations, disorganized thinking, lack of motivation, and change in sleeping patterns among others. It is majorly caused by genetic factors, family relationships, stress, and drug abuse. The focus of schizophrenia treatment is concentrated on symptoms management.